Hello and welcome to Drugs Plus. Whether you're here for exam revision or just general interest, I hope you find this video useful. If you do, please give it a thumbs up and subscribe to support this channel so I'm able to continue creating this content. In this video, I'm going to discuss disorders of the thyroid gland. For a more detailed introduction to the gland and the hormones it secretes, you can see my dedicated video, the link for which I will provide below, but I will outline the basics now. When the hypothalamus releases thyrotropin-releasing hormone, it acts on the anterior pituitary to release thyroid-stimulating hormone. This hormone is secreted into the blood, which transports it to the thyroid gland, which sits just below the larynx in the throat. Inside the thyroid are thyroid follicles, balls of epithelial cells which produce thyroid hormones surrounding proteinaceous colloid, which stores the hormones. These are T4 and T3. Both of which bind to thyroid receptors, which dimerise with retinoic-acid-bound RX receptors. This complex goes on to alter transcription, particularly genes involved in increased growth and development, basal metabolic rate, cardiac response to catecholamines, and nervous system excitability. Although this may seem like a well-oiled machine, that isn't always the case. Hyperthyroidism, or Graves' disease, is an autoimmune disease whereby the body produces antibodies which mimic TSH to induce the secretion of thyroid hormones. This causes weight loss, heat sensitivity, increased cardiac activity, a hyperactive nervous system which can lead to tremors, and large lumps in the thyroid gland, known as thyroid goiters. One treatment for Graves' disease is the use of antithyroid drugs, such as carbimazole and methimazole. These drugs work by inhibiting the iodination of tyrosine molecules, which ordinarily go on to form T3 or T4. People with Graves' disease also take beta blockers, which, although have no effect on the overactive thyroid, do treat some symptoms of the condition. If the symptoms become unmanageable or drugs are not well tolerated, some patients opt for surgical thyroidectomy, although this is a risky procedure as it can cause damage to the parathyroid glands. Hypothyroidism, or underactive thyroid, can be caused either by the autoimmune destruction of the thyroid gland, also known as Hashimoto's thyroiditis, or more often in less developed countries by a low iodide diet, preventing the synthesis of thyroid hormones. A deficiency in thyroid hormone removes the negative feedback loop for its secretion, resulting in high levels of TRH and TSH, both of which cause thyroid goiters, weight gain, and cold sensitivity. Thank you for watching this video. If you found it useful, please give it a thumbs up and subscribe to support this channel so I'm able to continue creating this content. I'll be back with more pharmacology videos soon.